To survive regulatory scrutiny in pharmaceutical manufacturing, you have to master the temporal analysis of your data points. Often, quality control teams confuse a passing result with a stable process. This confusion typically centers on two critical metrics that govern deviation management: out of specification, or OOS, and out of trend, or OOT. A common misconception among junior analysts is that any test result falling strictly within predefined limits inherently guarantees a safe, high-quality product. Misunderstanding the distinction between these two states leads to one of two outcomes: unrecoverable batch rejections or catastrophic missed warnings. Recognizing the exact statistical difference between an OOS and an OOT result is the mathematical foundation of proactive process control. Let's look at the strict operational parameters of out of specification. This chart shows a standard statistical process control setup. We have clear horizontal boundaries, an upper limit at 105% and a lower limit at 95%. If we log a data point at 92%, it sits visibly outside that lower boundary line, triggering a failure marker. This state is exactly what defines an OOS result. The primary impact here is direct. The product's quality is compromised. It also suggests a systemic breakdown somewhere in the pipeline, whether in the testing process, the analytical method, or the raw materials. Regulators mandate an immediate response to this state: strict containment, halted processes, and often complete batch rejection. OOS is a lagging indicator. By the time you see it, the critical failure has already occurred. Now we shift to the more nuanced metric, out of trend. This chart shows a historical baseline. Recent data points track closely together at 98%, 99%, and 100%, well inside the boundaries. Then an anomaly appears. The next point populates at 95%. It doesn't cross the boundary lines, but breaks the tightly clustered historical pattern. This structural break is an OOT result. You might ask why a result that perfectly passes the specification limits still requires a QA investigation. We investigate because this variance is a statistical early warning signal of underlying process drift. OOT is a leading indicator. It gives you a predictive window to intervene before the system entirely loses control. Managing an OOS and managing an OOT require completely different operational postures. Mathematically, OOS is outside the limits, while OOT is inside the limits but anomalous. Operationally, OOS dictates reactive quarantine, while OOT dictates proactive monitoring. Yet, despite their distinct statistical profiles, they stem from the exact same shared pathology. The deviation could originate from direct analytical or operator error during testing, or it could be a sudden hardware failure. It might be sample degradation, inherent process variation, or raw material inconsistencies. The underlying fuzz is identical in both scenarios. The only difference is the exact moment in time your statistical model caught the anomaly. Once an anomaly registers, QA teams must execute specific, actionable protocols. The first phase of the OOS protocol requires immediate reporting up the chain of command and physical quarantine of the batch. Phase 2 demands the initiation of an exhaustive, formalized root cause investigation. The primary objective here is to immediately execute definitive corrective actions to rebuild a manufacturing system that has already broken down. The OOT protocol functions differently, prioritizing advanced data tracking over immediate production halts. The first phase of handling an OOT involves executing deep trend analysis, comparing current variables against broad historical datasets. The second phase implements intensified close monitoring of all subsequent batches. The objective of the OOT protocol is to investigate structural drift and deploy preventative maintenance before a failure happens. OOS protocols are designed to contain a disaster. OOT protocols are designed to facilitate continuous improvement. Let's see an OOT become an OOS. This chart plots an assay trend starting at 99%. The data safely decays to 98.5%, then 98%. Then it drops to 96%, a critical warning signal hovering just above the failure boundary. This specific 96% reading represents your final operational opportunity to intervene. An ignored OOT signal is simply an OOS waiting to happen. If you take no action, the trend line inevitably drops to 94%, crashing through the lower boundary limit and triggering a massive failure indicator. OOS shows you the problem. OOT warns you before it happens. Pharmaceutical teams can actively upgrade their process control to manage these signals effectively. For incident management, specialized support is available for rigorous documentation and root cause investigations. For proactive preventative architecture, teams can easily access SOP improvement, detailed document review, and practical QA and QC training. Engineering teams looking to advance their process understanding and reduce errors should connect for specialized support across these 4 pillars. Mastering the gap between a trend and a failure builds a system where stability is maintained through data, stopping deviations before a production halt.